Welcome to the Misfit One Lifestyles with Elizabeth Colin. She will awaken and connect with your Misfit One. Are you tired of the ups and downs in your life? Are you ready to live a healthy lifestyle once and for all? We are talking about all aspects of your life. Being fit is not just physical, it's also your mind and soul. Learn how to take steps in your life to move towards your goals. Elizabeth's goal is for everyone listening to the sound of her voice to get fit. Let's get focused, let's get intentional, and let's transform. Now here's your host, Elizabeth Colin.
Hey guys, it is the end of the week and it's another episode of Sheen Talk Live with your host, Elizabeth Colin, also known as Misfit One. Today's guest, wow, she is wow, so smart, so intelligent, DrVivian Bay, and we are going to be talking about boobs. All about boobs and how we can take care of things. We're still continuing the Breast Cancer Awareness Month because it's so important for us to know the ins and out of it. And she's the one. She is the specialist oncologist in New York. I can't wait for you guys to meet her. So, if you have any questions about mammograms, prevention, any myths, anything, just go ahead, text it in. How you guys doing? Everybody good? Hey, all's good? Good. I am so happy to be with you guys today for another Fit Friday. Fit Friday. Did you guys already work out for today? Good morning. Thank you. Good morning. Yeah, I did my workout somewhat. I still have to go walk my dog, but that's mostly his workout, not mine. But the weather is nice. Where are you guys? Is the weather nice? Yes. Over here too. I'm so excited about another great weekend. I shouldn't live for Fridays. I mean, they say don't, but I do. I really enjoy Friday. I don't know why. I get excited for the whole weekend. Any big plans this weekend? I don't have any either. We'll go to the wineries, but that's about it. Again, make sure you put in any question you may have. Go ahead. Hi. Type it on in here because DrVivian is the one who's going to answer all of these questions. She is so smart. I am so excited to speak with her. Riding your motorcycle. Okay. That's awesome. It's going to be very nice weather. Yes, she is. She is a sorority girl. She's going to talk about it. Hi. You guys. And also, listen, not only... Oh, I think she's here. Okay, don't forget. Put in your questions. Let's talk.
Hey,
how are you?
I am well. How are you?
I am wonderful. Thank you. I am so honored to be speaking to you. I'm like so smart and so just well-rounded. You're a mom. Oh, you've got everything going on. How are you doing in this pandemic?
Oh, child, listen, I'm good. I'm blessed. The family is healthy, so that's always nice. But, I mean, we were in the epicenter, in New York. And just when you think about breast cancer and just cancer patients and, cancer doesn't stop or didn't stop when the pandemic started. And so walking, patients through that was difficult, but we can talk about that. But my family is fine, thankfully,
Right.
and we're healthy, so I'm blessed.
Are you guys back at school? I think you're homeschooling. Or
Yeah, so I have two boys, a 10-year-old and a 6-year-old. The 10-year-old is a high-performance tennis player, so he was homeschooled already. Yeah, he was homeschooled already.
I love tennis. I played, but, not since COVID, but I love tennis.
Tennis is a great sport. So he didn't miss a beat with the pandemic. And then the kindergarten kid, he started homeschooling. My husband homeschools him, and we've been doing it for 4 years with the older, kids. So I've talked to families and moms about virtual learning and homeschooling, and it's certainly encouraged. It's definitely doable. But yeah, that's what homeschooling.
I mean, you're a super mom. So when
don't stop it.
already doing it. So you was like, look, ladies, I've been doing this all along, welcome to my world.
Yeah, but you know what? It's funny because there was like a negative connotation to homeschooling, okay. And then when everybody realized that this is like legit, I was like, gotcha. Yes. Try to tell y'all.
Always ahead of the game, girl. You always ahead of the game.
I try to be, just a little bit. Try to be like you.
I am so excited because you also are author.
I am. That's right. Yeah. So that was part of my son's homeschooling experience. As a Black child, we really wanted to encourage being an entrepreneur. And so one of his projects that we had him do was write a book and let's publish it. And what's the process of doing that? And so he's actually working on his second book, but we published The Chocolate Kid Chronicles, Please Don't Touch My Magical Hair. He's got nice curly hair. And everybody liked to touch it, so I had to teach him to say, that's my hair, don't touch it. That's my crown, leave it alone.
You can look, but don't touch. You can look.
You can look, but don't touch it. Yep, so we're working on our next book.
Very, very. I am just impressed with you all around. I know that you come from a large family, like you're the middle of 7 kids.
I am. So my parents, I'm the middle of 7 kids from inner city Washington, D.C. Mm-hmm. And my parents, they were forward thinkers. We were homeschooled in the 90s, right? And it definitely wasn't popular then. But they believed in, sort of having some control and determining the narrative. And so, I applaud them. And yeah, the middle of 7 kids, we didn't have a lot of money, but we had instruments, right? So that was my parents invested in us with playing music. So that was sort of our foundation. And I play the flute. And I got my degree in flute. Do you play the flute?
I played the flute in the marching band. I started playing flute. I know. What's so funny, you're so proud of it. I really tell no one that I played the flute, but
I love that. Look.
That is awesome. But you went to college playing.
I went to college. Yeah, I had a full scholarship in classical flute. So, but I used that to pay. I knew I wanted to be a physician. I had a physician of color who looked like me. And I just thought, I can do that. I was always thought I could do whatever I set my mind to. Absolutely. And so I let that pay for college. And so I got my, then I went to medical school at Morehouse.
At Morehouse. And what I love about them, their mission statement is serve the undeserving.
That's right. Right. Exactly. Yep. And that's important, so that was one of the things that I really appreciated was Morehouse School of Medicine. They really focus on serving the underserved. And so everything that we did, it was centered around community, and that built my foundation. With every decision that I make, and even thinking about going into women's health, how can I serve my community? And so, I think as physicians, we have to really, and physicians of color, and we are a minority with that, and then a physician of color that's a surgeon, we're talking a couple of percentage as far as, physicians are concerned. How can I serve the women who look like me? And that's really my foundation was started at Morehouse School of Medicine.
And that's what I was going to ask, because you're doing that to this day. You are still serving your community. Somebody just said they're proud of you. You represent us well.
Thank you. Thank you, Mama. You
are so involved in your community. I just don't know how you have time to do Listen, you guys, can you tell them, Dr. B, what you do right now, where you're at?
Yeah, so I am a breast surgical oncologist, which means that I deal with breast issues, whether it's cancer or benign breast or high risk. And I'm a surgeon, so my primary method of sort of treating that is operating. I go to the OR. I am at New York Presbyterian, Brooklyn Methodist Hospital, and associate professor at Weill Cornell Medicine. And so a lot of what I do is I've built a program or building a program, a multidisciplinary program in Brooklyn with the goal of really, establishing a center that people can come in, women can come in and feel comfortable, right? And I think now more than ever, people recognize, the institution recognizes, the world recognizes that we do have systemic racism, we do have implicit biases, we do have health disparities. I mean, I can go on, and that ways that you address that are you have people who sit at the table who look like the people that in their community they're taking care of. So I'm the chief of my department. Yes. And, we're making moves. We do some community stuff, actually a lot of community stuff, which I can dive into. But because I'm so excited about what we do, but yeah.
Yeah, and I love how you kind of slip that in there. And I'm a surgeon, and I do this.
I work with my hands a little bit.
So here I have to get them insured.
They are insured. Oh man! And part of that though was to get excellent training. So I went to MD Anderson, which is the #1 cancer center in the world. I did my fellowship training at MD Anderson, and so I learned a lot about. Go ahead.
Is that in Houston, Texas?
That's right. Yeah.
Right.
Yep. In Houston, Texas, and have wonderful mentors and people who I always can sort of reach back to. But my main thing was, okay, now I've got this level of training. How do I use it to take care of my community? Right. So that's what I've been trying to do.
And you do it so well. I mean, when we talk about your community, people who look like us, and breast cancer is insane in our community. I shared earlier that my mom died of breast cancer when I was 11, but they have made great strides since. Right. But still, we still walking for cancer. We walking for the cure. We walking for this. Right. But how can we prevent it? What's the preventions of breast cancer? So,
with breast cancer, let me just start by saying, first off, I hate hearing stories like yours. And I quite honestly, I saw that and I was in tears because that's what we want to prevent, right? You were 11, right?
11 years old, yes.
11 years old. And like you said, we've made great strides. And so breast cancer is not a death sentence.
Right.
It's not. But as a community, and this is why I do, I get on Instagram Lives and I'm going in the community to tell women, all women, you have to get your mammogram. And even when you do that, and this is not to blame anybody, even when you do that, the outcomes still are not the best when you compare a black woman versus a white woman. So, right. So, and I can go into why we think that is.
Why is that? I want to know, why is that?
Yeah. So it's multifactorial, and a lot of research that I have done looks at what are those factors. And when I sort of think about it like a puzzle, and there are different pieces that we're starting to put together, but we don't have the whole story together. You understand? Right. Yeah. So it could be access. It could be that we, maybe you're not getting our mammograms. Maybe we get the mammogram, but then the follow-up, that's a part of it, but that doesn't tell the whole story. Right. Because even when we look at women who get their mammograms, which I know in the community, we're doing what we're supposed to do, right? Perfect. So we can't keep blaming us. But when we do that, it is also genetics. It's also, black women are more likely to have a triple negative breast cancer, which portends a worse diagnosis, right? Because then that has to be treated with chemotherapy. It's modifiable risk factor. So this is what you can change, right? No smoking. Smoking, of course, increases our risk of all cancers.
Thank you. Can you say that again one more time?
No smoking. My patients know when they come in, I'm just like, that's solid. We're not playing it, right?
Listen, we already have so many things going against us. Let's try not to do this. So
exactly.
No eating.
So that was the next thing. And I know you are a warrior in just getting, folks to eat right and to exercise. Those are things that we can take control of. I will tell you, I told my patients, I stopped, and this is just me, I stopped meat. So I am, you don't do meat either? Yeah. I do. So plant-based diet, it's so important.
Yeah. I eat food, but
I eat seafood too.
And I just stopped eating meat probably almost a year now. And also because my stomach just couldn't digest it. Like every time I would eat chicken, my stomach would.
Me too.
Cramp it. Yours too? Yeah, my stomach. But my stomach was like, look. So I started off by saying, how you eliminate things to see. And so I eliminated, because that's really was like the only meat that I ate. So I eliminated that and then had no problems. And so there's no need to go back to it.
Exactly.
And that's why I do what I do, though. Cancer has taken out most of my family. Like everybody in my family that I know that has been some sort of cancer. So I started researching it like crazy because what is this? Why is it killing my people? Like, and you are right on it. The number one thing is not to smoke and exercise and diet. And that is why I started this journey.
I love this.
When you said before how we doing our part, because we do go get our mammograms and just and I wanted to ask you about this for my own personal thing.
Yes.
I went to mammogram and they did find something. Oh Lord, this was last year. So I had to go back. But as a child of a woman who had breast cancer, just for them saying that I had to go back for another one made me go crazy. But then I'm scared. I make an appointment, and my next appointment was almost 3 months out.
Right. So that's what I mean by access. Exactly. And that's a problem. That's a problem. And so you're speaking to some of the things that I, as I talk about it, and bring it to people's attention, we could do everything that we're supposed to do, but it's these roadblocks. And it's understanding that, you can't you have to be empowered to say, no, I have an abnormal, this is not going to work. You're going to have to get me in to get the biopsy and get some answers, or then you go to somebody else. But that's what my team, we work to prevent, right? So people know they can call us and we will make it happen because there is a disparity between from screening to diagnosis. And then when you get that diagnosis, then who do you go to? Diagnosis to treatment. You've got to go to somebody who knows what they're doing, who's a specialist in the field.
Right.
It's all of those things. All of those things matter. But I'm going to give you a stat, though, just because I think it's important for us to talk about it. When we talk about health or breast disparities, right, it means while Black women are slightly less likely to be diagnosed with breast cancer when you compare them to white women, we're 40% more likely to die from the diagnosis. So all of these things that you were saying matter, right? And it should piss us all off. We should say, why is that?
Why is that? And what's crazy, and I think very good insurance. I think okay, might as well pay a lot so we can do this.
Right.
Right. And even knowing what I know about this, I still did not fight it. When I did say, wait a minute, I got to wait 3 months. Like, I'm scared. I got to wait. Right. Well, ma'am, we only have this. And I was like, well, what about? And honestly, I didn't have any fight in me because I'm so afraid.
Right.
I really just okay, whatever. I'm going to just.
Right. And that's a normal feeling, honestly. That is a normal feeling, and that's why we have to take the burden off of people, right?
Right, yes.
You have to take the burden. The system can be messed up in different places. We have to take that burden off. And so that's some of the things. One of the things that we're doing is we're increasing. So let's talk about COVID. So COVID came through, right? And as a result, because we had to shut down different locations and be conscious about the PPE that we were using, we said that the society said don't do screening mammograms like for a 3-month period. So what does that mean?
Right? I know.
So you don't do a screening mammogram. So who's going and then now it's opened up. So people are backed up. Places are backed up. Or maybe, I know people in my family are like, I'm going to wait until, well, don't wait, right? Because we already talked about the disparity. So what we're doing is we're increasing hours at the breast imaging department for women that we identify in the community through our community outreach, right? So that they can have a step in the front door, if you will. And then if there are biopsies that need to be obtained, they get connected to our navigators, right? So that they don't have to worry about that burden. But these are systems that are not set up at all places. They should be. And so that's one of the things I'm working on.
I really like that because I didn't even know, like I said, what to do, where to go, and it doesn't help. My husband was trying to help, but they don't really help. Right. Because he's ready to fight, right? And I'm like,
protecting his queen, right?
I just want to hide out. And you are 100% correct when saying if they would have took the initiative when I called back to say, now we're going to do this, but they didn't. It was just me. So that is something that I'm going to jump on your bandwagon and see what's happening around here. We need to get this together.
Absolutely.
I'm speaking firsthand, and this wasn't a long time ago.
Right. And you have a family history, which to me, that's a whole, we can talk offline. Something that makes me mad. but this, if nothing else, if I can empower women to say, trust your instincts, right? And, it's tough to say push through the system because, I do that every day. That's what I do. That's not what you do every day.
Right.
But know that you have a voice and allow your voice to be heard. And then this is a segue into, we talk about mammograms, but even when you notice something wrong with your body and you go to your doctor, you know where I'm going with this.
Because I heard it many times.
You know where I'm going with this. And maybe your doctor says, that's nothing.
Nothing.
Right? And I'm not blaming doctors. I'm a doctor, right? I love my I love my profession. But what I'm saying is you have to trust your instincts. And this is a doctor telling you, trust your instincts. And if you feel like you're not being heard, go to someone who will hear you. Okay? Because we are mothers. We are sisters. We are the backbone of our families. And if we're not here, think about where our society would be. So you have to fight. You have to fight for your health.
And that's so sad that we have to do that because many, 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 many times I would go and, oh, that's nothing. And I'm like, it's nothing. I feel funny. I don't know. I don't really feel like that. Oh, it's nothing. It's just this. And trust your instincts. And I am so blessed that I had strong people around me because that was when I was younger, probably in my 20s. And I was like, well, Daddy, they keep telling me nothing wrong with me. And he was, no, you go back because, this. And I was like, Daddy, I don't want to go back. They make you feel crazy.
They do. Yeah.
They make me feel like.
It's unfortunate.
Yeah.
It's unfortunate. Even when you talk about like maternal deaths, right? With the disparity that exists there, we're not heard, and it's unfortunate. But that's why you got to have, that's why I love my Morehouse School of Medicine, my Howard University. I love the HBCUs that push people of color out into the community so that we can be, the voice. So, absolutely.
It's so important, and I love it that you guys are making it longer hours so that people can get in. Now, how does that work? Do it like one at a time, or with COVID, do you have to let people? Can you walk us kind of through that?
Yeah, so the most breast imaging departments now have spread out the appointments so that they're longer for one patient, meaning one patient's in and maybe the other one is checking in, so that you don't have a lot of crossing. And then, of course, every place that you go, you should ask them what their standards are, but typically, they're going to wipe down the mammogram machines, disinfected, always have your mask on. Yeah. Yep. Always have your mask on. Bring your own hand sanitizer so that you can go like this. I've been known to be like, hey, you want to put some on? Here you go. There you go. There you go. There you go. Oh, hi, Kenzie. I see Kenzie. She's my son's bestie. They're doing a cooking class. They're going to start doing a YouTube video, by the way, Kenzie. Shout out to Kenzie.
Hey, Kenzie. Great question. I was going to get to that. Should women get mammograms before 40?
Okay, so guidelines, let me back up, because some guidelines and some folks will tell you that you should start at 45 or you should start at 50. That is absolutely not true, and do not apply it does not apply. Let me just say, breast specialists say 40. I'll just leave it like that. 40 and yearly, okay? If you have a family history of breast cancer,
right,
then you look at the age of the age of the person who had the youngest person who had the breast cancer, and you go 10 years before. And so if they had it at the age of, let's say, 45, then 35, you should be talking with your clinician about getting a mammo. If you have a family history, right, then potentially there's a genetic mutation that's driving this. Like Beyonce's dad had BRCA, the BRCA mutation.
I want to talk to you about that. Yes.
Talk about it.
Yeah. So I refuse that test, by the way.
And that's okay.
They want to give it to me because this is my logic, and you tell me if I'm crazy, because I could be. But my logic behind it is, listen, my mom died of breast cancer. My dad had prostate cancer. He beat it. Thank God he's fine now. My uncle died. I mean, like I said, I don't think I need a test to see if I have or not a gene for that. And I asked them, like, okay, so if it says yes, I do, well, then what happens? And then they said, well, they're gonna do a double mastectomy, or that don't make sense.
Let me clear it up. A couple of questions though, because this is important. This is really important. First of all, in our communities, we often don't talk about who had cancer in our family. So I applaud you for knowing and at least having that info. And I would encourage everybody to try to talk to grandma and understand what was going on, what happened in the family, because it helps empower you. So with a germline mutation like a BRCA mutation, you asked the right question. What does this change, right? And honestly, I don't like the response that was given. Let me tell you why.
Okay.
For people who are BRCA positive or have other germline mutations that are positive, there are guidelines that sort of direct us. We call those NCCN guidelines. And if you are BRCA positive, then instead of just doing the mammogram every year, I would actually have you do an MRI yearly. And I would be looking at your breast every 6 months, as well as doing a clinical breast exam. And so the goal and idea is in that way we can catch something if it comes about. We can catch it sooner, right?
That makes sense.
So that's a reason, because you can be proactive.
Okay.
Now, unfortunately, the people hear BRCA or are told BRCA, if you have a BRCA mutation, then you have to have a double mastectomy, and that's not true. There are two different pathways. Now, certainly that's an option that decreases your risk, but you can certainly choose to just watch and follow your breast closely.
Tell me that. They said, oh, well, I'm like, nope, never mind.
Nope. And then,
go ahead.
Now, the other thing is with, for example, the BRCA, there are other implications. Like if you have a BRCA mutation, then ovarian cancer, there's a high percentage or possibility that you would get ovarian cancer. And so seeing a provider and understanding what that means and being proactive in that way should empower you. Do you understand what I'm saying? To just carry a diagnosis, that's heavy. Like I wouldn't want to just carry a diagnosis, right? but to be proactive and empowered to make decisions sooner than later. That's the idea of knowing.
Well, that actually does make sense. And we got some really good questions in. And Shane, go ahead, girl. She took hers and it came out normal. No,
right.
Well, that's great. That's
right.
Good. And then what's the other question?
And she said her cancer was considered environmental. And that's something, when we talk about the puzzle and the pieces, that's another piece to the puzzle, right? Where are we living? What is our air? What type of products are we using? Right. We're looking at all of those things.
Right. Let's see. Is breast cancer awareness included in NCQA ratings? I feel like medical care providers don't grade physicians as much on this condition. Oh, that's a good question.
Yeah, that's a good question. I don't know the answer to that, to be honest. Yeah, I don't know the answer to that. I feel like medical care providers don't grade physicians as much on this condition. And I mean, I think you speak to the fact that quality matters, right? And physicians are graded on a number of scales. Quality matters. I'll just put it that way. So you're absolutely correct.
Okay, yeah. And so once we get the procedures of the mammogram, once we get in there, now they have options like the 3D one.
Yeah.
So I do the 3D.
Good.
And what was the other ones?
You have a 3D, you have a contrast enhanced.
Yeah.
You have the MRI, of course. You have the regular 2D. But this brings a good sort of point that about 50% of women in America will have dense breast. And so let's talk about what dense breast means.
Yes. Tell them about it.
So dense breast is, if you think about a chalkboard, right? It doesn't have any writing on it. And you take a picture of it, you can see the chalkboard. If you think of, and that's fatty breast. That's most older women have fatty breasts. If I took a white chalk and I sort of wrote all over the chalkboard, that's dense breast. Now, cancers are like salt. If I threw salt up against that chalkboard and there was a lot of writing on there, it's hard to see. So it's hard to see through that dense breast, and that's with the mammogram. So you should always have an ultrasound attached with the mammogram if you have dense breast, so that we're looking at your breast in different ways. And I find that there is a disparity in that.
I was about to say that. They don't offer you that. They don't.
I know. And that's why, I just hosted a CME virtual symposium, a week-long symposium, and the idea was to discuss with clinicians and providers, give them the tools necessary to provide quality care. But this is another angle, is to empower you. So, if you see on your report dense breast, most states will support getting the ultrasound as coverage.
Yeah, and that's very important, because they really, the only reason I am somewhat in the know is because I researched it myself. Like, I did the work, but I never, ever had a physician say what you just said. Do you want to have the and this or that? They never did that. It was it's just crazy. And then a lot of people I know in our community are afraid of mammograms. Because they're not exactly sure what happens, So can you walk them through what happens when you have a mammogram?
Absolutely, and that speaks to why we don't go sometimes, right? So one of the things we know is Pinktober, right? It's October. It's breast cancer awareness. So we're all seeing pushes for marketing efforts to go get your mammogram. But you bring up a great comment, right? That it can be painful, right? It's an experience where your breasts are pushed together. I've had a mammogram, and it can hurt. So what I tell women is you have to mentally prepare. Maybe get a buddy, in COVID times it's difficult to do that, but get a buddy. Make it a ceremony day, right? Make it we're going to go get some lunch, maybe get our nails done safely, and get our mammogram together so that you're not doing it alone. I mean, you'll be in the room alone. Right, because it's anxiety provoking. But for that brief period, it could save your life, right? It can save your life. And it's not painful for everybody, just some people. Mm-hmm. Some things that you can do if you respond well to like Tylenol or Motrin, and I'm not making any clinical recommendations, but you can take that before, right? You can take that before to help sort of alleviate that perceived pain. And then if you just generally have breast pain, there's a whole nother, because we always discount breast pain.
Right.
Stress causes breast pain. Eating,
Yeah. And vitamin E. Yeah.
Right. Caffeine. So vitamin E is great for addressing breast pain.
And what's also another good question is about breast implants, because they squeeze it in that machine for people. But if you have an breast implant, you don't want it to pop.
Right. So very low likelihood that it would pop. But I hear that often. They, just let them know that you have breast implants. A lot of women have breast implants. And so they will be thoughtful about that, but very low risk of them popping.
Oh, okay. Okay. Yeah.
Go get your mammogram, even if you have an implant. Go protect the girls.
Yeah. And you just really hit on one of the myths that your breast. I have a lot of people that have breast implants, and they're like, "Well, I'm gonna pop."
Yeah. Like I feel like I need to write a book about myths, but then just because there's so many myths. Here's another myth.
Talk to me.
I'm gonna tell you the myth. The myth is, have you heard this one? If I take you to surgery, right? The cancer's gonna spread. So in your breast, then the cancer is open to air and it's going to spread. Let me tell you where that came from so you can understand.
Okay.
So what happened? What had happened, right? What happened was back in the day when our older family members, right, had cancer. They didn't have insurance. They weren't able to go and get mammograms. And as a result, the cancer advanced, it spread. And then when it was so advanced, then they had surgery on their breast, right? And so they had to have, by that time, of course, a mastectomy typically because it was so advanced. They didn't catch it early. But it also spread. So the concept is when you go to surgery, it causes things to spread, but it was already spread. Do you understand what I'm saying?
It's like what a lot of black men say, I don't like to go to the doctor because I get sick when I go. No, you was already sick.
You was already sick. And then there's a question here about, is an MRI recommended to see better with implants? So you should talk to your plastic surgeon about what their recommendations are based on the type of implant that you have. But typically the answer is yes. They want you to get an MRI every 3 years or so, plus or minus, to look at the integrity of the implant. And that's really to look at the integrity of the implant. As an added benefit, we get to look at your breasts a little closer. MRIs are great. They're very sensitive, but they're not specific, so we don't use it as a screening tool for breast cancer, but it's a great modality and tool.
Yeah, that's a good one. Give us another myth, because that was great, that one there.
Let me think. If I didn't have, if none of my family members had breast cancer, then I can't get breast cancer.
Oh my gosh, yes.
So the majority of women, right.
That one hurts.
Breast cancer.
It hurts my heart when people say that, because it's not true.
It's not true at all. It's not true at all. Actually, the majority of breast cancer is what we call sporadic, so they don't happen due to a gene mutation. So it's important for us to know that. Right. That it's good to know if your family has it so you can do some things and be cautious, but doesn't mean that you won't have it because your family didn't.
That doesn't give you a free pass.
It doesn't give you a free pass.
Yeah, because, the people that I do know with breast cancer, they're usually the first person in their family to have it. They didn't have the history. So, that is so crazy how... And we listen to other people instead of the doctor, right?
Right. Right.
It's like, well, who told you that? Well, my cousin said. Spooky don't know.
Right. It's true. And look, there's a good comment here about It says what's crazy is it almost seems based on campaigns, breast cancer most likely affects white women almost exclusively, and that is another sort of example of representation and how it's important for us to go out and talk to, our community and encourage. I mean, every last one of y'all on here can go and talk to your friends and encourage them and just tell them something that you learned today. I mean, that would make me so happy that, yes, Black women, right, can get breast cancer. And again, it's not a death sentence, but the sooner you get treated, the better, and go to somebody who is well respected and, is a specialist in the field.
That's important because that goes to your resources. Like,
Yes.
What are the resources that we look for? How do we go navigate that?
Right. So most academic centers definitely have, breast surgeons who are fellowship trained. You have great community centers as well that have breast surgeons, maybe fellowship trained or not. Word of mouth, of course, matters. Again, I strongly believe that if you find somebody, just find somebody that you can relate to, that you feel like is listening to you, because ultimately that's, most important. You want to see if they have accreditations, if the centers have accreditations. Those are just some things to look out for. But every place is certainly different. You can go to the American Society of Breast Surgeons website to see, where the different centers are as a start.
Right.
And then
go ahead.
Go ahead. I was going to say another great website is the American Cancer Society.
Yes, it is. And I go on there and look every once in a while, and I am so happy that they do have breast cancer awareness.
Right.
But it's something that we should be thinking about year round.
Yes.
And what do you feel about self-exams at home?
I am, listen, I love self-exams, self-breast exams.
Mm-hmm.
Get to know your boobs.
Yeah, go ahead and touch yourself. You all right?
Go ahead and touch yourself. Go ahead, have your partner touch yourself. You don't,
Yes.
Just do some touching. Because listen, now some of the guidelines will say, oh, it's a waste of time. But I don't believe that, because if you are able to, it goes back to understanding who you are and allowing yourself to be empowered. Feel yourself. If you feel what is there, when something changes, then you'll know, right?
Yes.
And then you know how hard to fight. But we always say do breast exams. And if I had my breast model, I would show you, how to do it. But I'll show you, take your fingers, right? And then you just want to make sure that you are covering your whole breast, right? As you go through. You want to you start out soft and you go, exactly. And then you press a little harder. And if you feel something, go and get it checked out, right? And if it's normal, wonderful, wonderful. Now you know that that's normal for you. And then when something else comes, still go get it checked out.
Right.
Okay.
What I found is a lot of men find stuff for their women, their wives. They are the ones that usually say, "Hey, what's that right there?" And you go, wait, what? And it's crazy because I guess they are on it. We the ones like, okay,
right? Exactly. And then also telling them what the signs are. So anything that's palpable, a mass, a lump, a bump. If you have skin changes, and this I should say, this kills me. If you never had eczema before, it's just not gonna pop up on your breast, right? That's a reason to go. Don't assume that it's eczema. Go get it checked out. And I can't tell you how many people. I mean, it's a common trap. Go get it checked out. If you have nipple discharge and you're not breastfeeding, go get it checked out. There's no harm in going to get it checked out. Remember, ladies, we have to be here for our families. We have to be here for our community. Right. So take care of yourselves.
Thank you so much, because it is one of cancer is like killing them out there in these streets.
Yeah.
Killing them. And I am so honored that you took time out to come
It's my pleasure.
To people, because this is so important, and you are saving lives every day.
Thank you.
We're so proud of you.
Thank you, Love Bug. And I have to give a shout out to Cynthia Horner, who hooked us up, and the illustrious ladies of Sigma Gamma Rho Sorority Incorporated. I got to say that. And then also, one of the pushes is really all sororities, all sisters, all communities. We have to talk about it. We have to continue the conversation about our breasts. And I'll leave you with this. Well, I don't know if you want to get off the channel with me now or not, but this is what I would love for all of us to do is if you can, breast cancer affects 1 in 8 women. If you can go and encourage 8 women in your life, your girlfriend, your sister, your soror, your mother, your auntie, whatever, to go get their mammograms this year, despite COVID, right? Then you've made a difference. And then tell them to tell 8 other women. So let's spread the word.
That's it today. We all heard it right here. Once we get done, I want everybody on that phone.
Yes. Send that text out.
Send that text. And 1 in 8 women that's just crazy. That's just crazy. So
and I want to thank you. I want to thank you because no, you share your story. And it's, like I said, that's hard to do. But it puts things in perspective for us all, right? And so thank you for taking the time to spread the word about breast health because it's important.
It is. Thank you. You guys, which way can we stay in touch with you?
Yeah, so you can follow me at DrVivian, MD, DrVivian, MD. Let me do that again. DrVivian, MD on Instagram. I'm also on Twitter. Follow me and I'll start dropping some facts or continue to drop some facts about breast health throughout the year, not just October.
Bam.
Bam.
So much for tuning in to another segment of Sheen Talk Live. And remember, go ahead, touch yourself.
Touch yourself. There you go.
Okay.
Bye, love.